Hi, Colleen from Let's Talk About It. It is day 6 after my nerve decompression surgery in the back of my head. Um, Things are going well. I think today would be the day I would say where I felt like I turned the corner. Um, I have pain, definitely pain. It's like a burning pain. Sometimes I get really bad ice pick pains in my head, but it seems to be after I move around a little bit, trying to walk or move around. So yeah, so that's a thing. Again, the back of my head is numb, but there are definitely places that, yeah, I can definitely feel pain, especially here, up here. So the doctor, when he decompressed my nerves, the concept is like, okay, you open up the back of my head and he tries to find the greater occipital nerve. He did 4 nerves, but the first one, right, is the greater occipital. He finds it and then he has to cut through muscle because your nerves go down into muscle and then up and around. So he had to move the fascia, cut through muscle, and then cut all the way from like my neck area all the way up to the top of my head, that same nerve, and then some of the branches. So he said they were very, very, tangled and embedded. So you think about that. It's cut, 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 cut. So from here to the top of my head. So I'm getting a lot of burning sensation at the top of my head today and some ice pick pains here and on the side. My neck is still tired. It does hurt a little bit when I move my eyes a lot. Walking definitely exacerbates the pain, so you just have to be careful. It's doable. I'm just using Tylenol and ibuprofen now. It hurts though. I will tell you, I take a gummy at night because I need to sleep and it's really painful. This has been a godsend. This thing, again, it really hurts to put my head back or anything to touch my head. So when I put this around my neck, it actually holds my head up without anything actually touching my head. I had my daughter put this fuzzy blanket behind me because that's a little bit softer. And I also have this pillow that's actually for my little dog, and it is perfect to fit right behind my neck. Again, it doesn't touch the back of my head, so it just kind of gives me a little bit of relief. So that's one of the things I wasn't expecting, is like so much stress and pressure on my neck to hold my head up, and my head being really sore. So those 2 things are really, really helpful. On and off with the ibuprofen, and the Tylenol is also very helpful. There can be no heat and no ice. That's very, very strict doctor directions because these are sensory nerves and they're not picking up the senses, so I could easily burn myself or hurt myself. So that is a very strict rule. I want to put ice on my head for sure, but I can't. I also want to really lie down, but I can't do that either. For 3 to 4 weeks, I need to kind of keep my head up, really not bending over, not picking anything up heavier than a pair of shoes. So when it comes to like getting help and, knowing like what do I need to do to prepare, like I said, the recliner is important. These little pillows are important. Having a little table next to your chair is important so you can have your drinks and your things and your whatnots. But there's no taking out the trash. There's no bringing the trash to the curb. There's no picking up a gallon of milk or even a quart of milk. So, filling a flower vase up, like, no, the vase has to be empty and put on the counter. Then maybe you can move the faucet, if you have one of those. But you can't pick up a big container of water. That's not happening. Laundry, no, that's not happening. My daughter will do it. She'll give it to me. I can fold it, but I can't bend over to put it in the washer, out of the washer, into the dryer, out of the dryer, or pick up a laundry basket. So that's not happening either. So those are the things that are really challenging. Grocery shopping, right? You're not gonna be able to go grocery shopping. You could probably, like, I can't do it now, but when I'm ready, I could probably walk through a grocery store. But if you think about putting 3 things in a bag, you can't lift the bag. And then the bag has to go into your car, and then you have to take the bag out of your car and bring it into the house. None of that's happening. None of it. So, I'm definitely going to look at my son's going to, he's going to go to Costco for me, and then I'll have friends, like I'll order from Acme, and as long as you have the code, you can just pick up the order from Acme. And I use Amazon a lot. So again, I can't pick packages up if Amazon delivers. I'm not picking those up off my front porch. They're going to sit there until someone comes here to help me to grab them. So those are the things you got to kind of think about ahead of time, you know, having somebody with you or having somebody stop by every day. Making dinner, there's no filling up a pan with water. There's no picking up a cast iron pan or a heavy pan. It's not happening. So dishwasher, not happening. So a lot of those everyday things, I bought a lot of paper plates, a lot of paper towels, like, you know, that kind of stuff. I'm really trying to eat a high protein diet to help with my recovery, of course. Drink lots of water, lots of protein, listen to my body when I can, you know, rest when I can. So that's really what I'm doing. I'm kind of embracing the, you know, the chill out and heal part. We'll see. In a week, I'm sure it'll be markedly different. For me, I am having balance issues. I'm going to have a Zoom appointment with my brain injury doctor on Tuesday. And then in 2 weeks, I'll see my surgeon who did this surgery as well. So far, so good. That's where I'm at. And I'll check in over the weekend. And hopefully it will be better and better every day.